Heidi ho, everybody. Beautiful, sunshiny Thursday. There's no better time to dig into this. So, what if I told you that your baby's latch issues actually have less to do with your milk supply and more to do with the force that we used to yank them out of you? What if colic and reflux and constipation and uh, people talk about, fussy baby syndrome, or I think of like the witching hour people joke about. What if they weren't just random rites of passage, but maybe silent stress signals from baby's nervous system saying, like, help me out. I am frazzled. I'm not okay. So we're going to stop calling it normal just because it's common, first of all. Also, what if I told you that the way that your baby was born, be it C-section, vacuum, forceps, really freaky fast, really freaky long, completely normal, could actually leave behind hidden stress signals in both you as mama and in baby? And what if the most powerful way to help your baby thrive is a lot simpler than you think? Every birth tells a story, but not every story gets the chance to heal and redeem. So in this workshop, we are going to be talking about the untalked about. And I want to show you how to turn survival WTF into thriving for everyone, for mom, for baby, for dad, the whole dang family, right? So I'm Dr. Mark. If you aren't familiar with me, I am a prenatal and pediatric family chiropractor here at Healing Touch Chiropractic in West Fargo. We have 3 docs here in our office. I'm a mom of 2. I am committed to helping families transition and see truly radiant health, especially as it relates to pediatrics and family, and big picture, truly radiant life. I'm also passionate about maintaining birth integrity and healing the bounce back from. I've done extensive research, education, and training into all things health and wellness for kids and families, ranging from pregnancy to infancy to childhood to beyond. So today we're talking about birth trauma, and it seems that it's become a bit of a buzzword in recent years, and some might regard it as a bit of a dramatic label, but the reality is that it is real life for many moms, which means it's a reality for many families. And today we're going to talk about what birth trauma really is, how it affects both you and your baby, and what you can actually do about it. So we are going to call a spade a spade. Birth is intense. It's magic and it's miraculous and it's beautiful, yes, but the facts stand that baby explodes out of essentially something that is the size of a pocket. And even when labor goes 100% according to textbook, it is still a heck of a ride. It is intense. And if you've given birth, you know it can be a little bit of a whiplash. Even looking at this photo here of our second babe, which was a completely awesome experience. At home, we have my husband there, our oldest, Hank, my sister, my mom. It was an uneventful birth. At least she's healthy. That's all that matters. Look at those cheeks. Those actually do nothing. I mean, if you've given birth, you've probably heard something similar along those lines. Those actually do nothing to validate like the freaking roller coaster that you both just went through. So everything we go through, moms with our hey nanny, hey hey, baby goes through ideally head first, and then like with their entire bodies. So that leaves an imprint, whether it was fast or slow or long or surgical, assisted with vacuums or forceps. The way a baby enters the world matters. And then we add in a whole bunch of intervention, and those matter too. And it all adds up. So birth trauma is anything that causes lasting stress on the body, yours and or baby's. So it's not always physical. Sometimes it's what didn't happen. Maybe you didn't have a beautiful redemptive birth experience, or maybe you didn't feel heard when you voiced a concern, or maybe you didn't anticipate the long recovery road ahead, or maybe you did, but you were extremely anxious and worried about like your pregnancy or what delivery would look like. Birth trauma also encompasses the emotional and psychological trauma experienced by both infant and mother. And spoiler, Babe is a literal hitchhiker to your nervous system. So if you, mama, were stressed and anxious and medicated and overwhelmed, hands down 150%, your baby inherits that, because 50% comes from mom, 50% comes from dad. So you and baby, especially, you co-regulate. Your two nervous systems share a frequency. So what happens to you happens through them. The unspoken truth is birth trauma doesn't end after the cord is cut. It echoes. It echoes into feeding, into sleeping, into behavior, into bonding. And here's the kicker. We often think like kids grow out of stuff. They actually don't. They grow with those challenges unless we intervene. So if we're going to talk about the nuts and bolts, let's just look at the physical first. Let's look at cord wrapping. While many babies are born with a cord loosely draped around their neck and it's not an issue or a concern, a tightly wrapped cord is a different ballgame. And this can compress the fragile structures of the upper cervical spine as well as the brainstem, which, didn't you know, this is responsible for controlling latching, for breathing, for sucking, for sleep, for mood, for cardiovascular function, so many things. This area is dense with neurological tissue that forms the critical junction between the brain and the body. So if you have sustained pressure and oxygen deprivation, right, during delivery, it's going to cause what we as chiropractors call subluxation. This is going to ultimately affect how the brain and the body communicate with each other, those pathways. Cord wrapping is also one of the main reasons why focusing on optimal fetal positioning can be so detrimental. I remember being pregnant. People would frequently ask, oh, do you know where baby's at? Well-intentioned, right? But that's not the only piece of the puzzle. And in this instance, like for sure, there's an ideal. We want to see baby upside down, facing the backwards. Babe also has innate wisdom of their own. So if the cord is wrapped around the neck, baby will naturally know that assuming a head down position might be catastrophic. It might further strain their body as well as the soft tissue responsible for supporting them. Hence why baby might stay breech or sunny side up or one of the other various positions that we deem less than ideal, okay? And if we're talking about abnormal fetal positioning, like breech, for example, where the feet or the butt come out first, or if we're talking about transverse, which is sideways, those in itself can be a cause of birth trauma. Many times, those abnormal positionings can lead to induction. Artificial initiating or like augmenting labor through medication can actually lead to stronger, more painful contractions. Normally, when you have that fundus, the fundus is like the uterine muscles that build at the top that actually help to you can't see that. That fundus pushes baby out as the walls of the uterus clang together like perfectly timed cymbals. You add in Pitocin and those cymbals, maybe they're going at different speeds. Maybe they're really stinking strong. Maybe they're not going at, there's so many different scenarios here. And when we have this really intense uterine activity, it can actually force baby into a compromised position itself. And it can put more strain on their head, on their neck, on their spine, ultimately, as they navigate the birth canal. And that awkward, or the combination of awkward positioning and exaggerated contractions, increases the risk of neurological strain and injury. The picture that I have here, I didn't think that it was fair. It talks about, the OB cascade of interventions. But in that instance, that's not OB, right? Like that's a physiological possibility. So I did want to point out that not everything is that, but birth in itself is a cascade. So our first labor and delivery could have very well ended up this way, in induction. Most inductions end in C-sections. So with our first baby, our son Hank, I labored at home for what felt like forever. It ended up being like 31 hours, which if you've had a baby, that is forever. My husband would agree. And I'm sure if Hank could have talked at the time, he would have definitely agreed. So what happened was our midwife had coached me to push early on in labor. And those are her words. That was actually her admission afterwards, that she counseled me to push too early. So that early pushing was essentially like a toddler taking a Hot Wheels car and ramming it into a wall. It's going nowhere, right? Nothing is happening. So that caused my cervix to start to swell, as you might imagine. So after some time of pushing, our midwife then coached me to stop pushing, give the soft tissue a chance to reset, to relax, and hopefully that swelling is going to go down. So in the progression of labor and all that premature pushing, Hank's heart rate started to consistently drop, which heart rate dropping in itself, it's natural and it's expected as baby descends and those cymbals start banging on him, right? But a heart rate that's continually low is problematic. So we labored at home, but with all that, we ended up transferring to the hospital so they could monitor him as well as my cervical swelling. And we were at the hospital for, I don't know for how long, but our delivery nurse had actually recounted a previous labor delivery that she was part of where they had administered Benadryl to mom to reduce the cervical swelling, and they suggested we try it. I was extremely hesitant, extremely reluctant. I was dead set on having my baby 100% drug free. So ultimately, we chose to do the Benadryl to try it after our midwife, who had transferred with us to the hospital, she was serving as an additional support person / doula, since we were in the hospital walls now. We're not in our comfy home where we planned to have Hank. So she reminded me that if the cervical swelling didn't shift, that induction was very, very likely. And I am so grateful and so proud that we were then able to proceed with a vaginal birth using just Benadryl for medication. But you can see how quickly and easily that cascade of intervention starts. We talk about like a cascade, but it's really a slippery slope, because really it's more like a freaking avalanche. One tweak becomes a twist, becomes what we are now calling birth trauma. And everyone's just standing around. I mean, this isn't always, but like people are standing around, with clipboards pretending like this is standard. So if a baby's head gets vacuumed like a dented golf ball, then swaddled up really tight and shoved into a plastic bassinet with zero nervous system support, are we really surprised that baby screams all night and struggles to latch? Like, come on, guys. Like, we owe our babies better. Another cascade outcome, C-sections. Yes, I said most inductions end in sections. Not such a fun fact. They can also be life-saving, yes. But when we look at what's happening from a biological and physiological perspective, they are freaking abrupt, right? So baby is pulled, cut out of mom's tummy, so they don't get the squeeze of the birth canal. So that actually is really stinking important, because traveling through that birth canal is going to help expel amniotic fluid from baby's lungs. It's going to stimulate cranial nerves, which are vital for things like digestion and latching and sleep and their demeanor, immune function. I mean, so many things. Plus, when they bypass that vaginal microbiome, it's missing the initial immune boost that babies receive by mama just by literal rite of passage. You guys know I love a good pun, right? Now we talk about vacuums and forceps delivery. Okay. Those can involve over 50 pounds of pressure, mechanical pressure on a newborn skull. And like, that's not just a bump. That's cranial molding. That's nerve tension. That's massive stress signals to their developing nervous system, which its only task, even for us as adults, the nervous system's only task, keep us alive. It does this by reading every stimulus into that nervous system, be it through our five senses, through our digestion, through respiration, through whatever it is, threat versus safe, threat versus safe. So when we have strain on that neck, skull, cranial bones, all of those, that's a huge input in that nervous system. That's freak out mode. So with this, we often see, and not just with this, with birth trauma in general, the effects that we often see are poor latch or difficulty breastfeeding, colic, sleep struggles, digestive issues, respiratory problems, ranging from a whole host of sporadic wheezing to asthma to RSV to bronchiolitis. I mean, there's increased risk of jaundice. There's immature or compromised nervous systems, which set the stage long term. These things can look like developmental delays in motor skills or language or social interaction, potentially like extra sensitivity to sensory stimuli. We've all been tickled before, right? There's a certain level of tickle that's normal, but if your kid is ultra uber sensitive to tickle, that's a pretty good indicator that that nervous system is ramped up. Also, long term, we're looking at autism spectrum disorders. We're looking at increased risk of ADHD or learning disorders. And you're telling me that nobody's following up with that baby's nervous system. This is criminal, guys. And for you moms, we're looking at scar tissue. We're looking at pelvic floor dysfunction. We're looking at abdominal wall separation, hormonal chaos. All of that is real and often just brushed as like, oh, just part of motherhood. But guess what? Dismissing it doesn't actually change anything. It doesn't make it disappear. So we have to do better, both as providers caring for moms and as for moms ourselves, to advocate when things are not right, to get back to our set point, to get back on our feet. So when we talk about chiropractic care for both mamas and babies, which, hello, that's what our office specializes in. Yes, this is baby Theo getting adjusted in our bathroom. She was maybe 5 or 10 minutes old, right after she was born. This is what it looks like when mom is a chiropractor and baby is tiny and a captive audience. Mom was exhausted from labor and delivery. But talking about chiropractic specifically for babies, every assessment and piece of care in our office is designed to not just be effective, but it's also going to be safe and gentle. So when we have that trifecta of assessment and care, not only is it going to help release cranial tension, but it's going to help regulate that nervous system, and it's going to support digestion and latch and sleep and immune function, healthy growth and development. And that's like without cracking, that's without popping. We literally use the same amount of pressure that you'd use to check the ripeness of a tomato, right? Or that you'd apply to your eye without being like, ooh, this is problematic. Oh my gosh, sidebar. Do you guys remember? I was never one of these kids, but someone on my bus would always take his eyelid and like flip it out so you could see like underneath his eyelid. Oh, and then he'd leave it like that just to like make my stomach churn. Like, bleh. But anyways, there's the minimal pressure to there. It's more about tuning the system, okay? Rebalancing, reconnecting. So most babies are dealing with unspoken stress like colic and constipation and feeding issues and sleep chaos. Those are all signs of dysregulation. And a baby's nervous system doesn't have words. Babies can't tell us those things. It has symptoms. So gentle chiropractic helps them switch out of fight or flight, threat, protection mode into thriving and co-regulating with you. You can actually see in this photo the symmetry or lack of symmetry. I can say this is my kid, so I can call this out. Because facial expression and tone and symmetry, left versus right, tell us a ton about the nerve supply and muscle tone. These same nerves governing those pieces come directly from the brainstem, and they're responsible for controlling, any guesses? Breathing, sleep, digestion, suck, swallow, immune function. So when we see asymmetry in a baby, we're really looking at underlying stress and imbalance in the system's core control center. I've talked about this before, but honestly, the best way to see this, because we're so subjective, right? Especially with our own kids. Like, oh, they're perfect and wonderful. And yes, your kids are perfect and wonderful. That's not what I'm saying. But snap a picture on your phone, just dead on of your kid's face. And even if you were to, like, if you've got, little kids, you could go like chest, because you can see it in shoulders and collarbones and like rib markings and indentations. Take a picture of your babe's face. And then when you go to edit the photo, flip it 180 degrees so your baby's upside down. It's going to make it really stinking obvious. You're looking at eyebrow level, you're looking at eye level, you're looking at lines underneath their eyes, nasal label lines, you're looking at creases, you're looking at, in this photo, you can see like Hank's jaw is deviated to the side. You can see one eye is open more than the other. Those pieces are huge because, like I said, they tell us about nerve supply going to those areas. So when we see asymmetry, we're really looking at signs of underlying stress, underlying imbalance in that nervous system. For mamas who are obviously not just starting out with their life, chiropractic care is about restoration. So adjustments help, of course, realign the pelvis. They're also going to help release diaphragm and abdominal and pelvic tension. They're going to support your vagus nerve function. They're going to calm an overwhelmed nervous system. Mama, your healing matters. So many times we see babies, like moms will bring babies in because they know something's off. But truly, like, moms, you gave birth, but you were also born into a new role. So chiropractic honors your recovery as well, because your regulation helps regulate your baby. During delivery, which seems like it goes on forever and ever, we might be thinking, like, mom, is this ever going to end? But in reality, delivery is just the start of healing, right? It's the start of a busy recovery, the start of a new season of busy. So labor, yes, might look like this picture here that I have for stretches, but it's a whole opening and a whole roller coaster has unraveled. Chiropractic is crucial in the restitching together of that, of the restitching together of yourself, in the restitching together of your family, in the restitching together of your home. The bottom line is, like, the spine is your GPS. Postpartum doesn't mean broken or lost. It means you're recalibrating, and chiropractic helps you recenter. All right. So in many countries, and this is like pediatric and prenatal chiropractors are tasked with getting this different. But in many countries, babies are checked by a pediatric chiropractor within hours of birth. In the US, it is more common for us to evaluate the car seat angle before we're talking about the neural system. So let that sink in a little bit. We'll obsess over car seat angles, but we're going to ignore the 50-pound force that was applied to baby's head. In what realm does that make sense? This has to look different. It's not even about fear. This is about awareness and then doing different. Peace out. I just realized what I'm doing. So what actually helps? What moves the needle for real recovery? Because healing just isn't about ice packs and adult diapers, as you're probably gathering. Although those do help, let's be real here. Real healing includes what we break into maybe 3 categories. So what I'm realizing here, postpartum power tools sounds a little bit scandalous. So maybe postpartum, I can't edit this as we're going along, but postpartum healing is what this should say. Okay. So obviously chiropractic care is going to be central of the spoke. Nervous system regulation looks like breath work. I actually included the link for my favorite, box breathing. That will take you to a video, a really quick video that'll teach you how. It is super easy. You can do it multiple times a day. Also included is vagal tone. So the things that I have listed on this right side of the slide, these will actually help recruit that vagus nerve. So fun facts, vagus nerve is known as the wandering nerve. It is the longest nerve. It comes right off your brainstem. It's paired. Your cranial nerves are all paired. There's 2. But it's the longest nerve, and it chats with every major organ in your thorax, in your abdominal cavity, in your pelvis. It is a huge brake pumper. So it doesn't have to be these huge global things, humming, singing, cold exposure. That is global, right? But things as simple as that will help recruit that vagus nerve, which is going to help pump the brake pedal. Movement is the next thing I have on here, which should be as easy as walking. If you're looking for some additional support, I also included the link for Mutu. It is my favorite self-guided online program. It's 12 weeks. It is perfect if you are seeking direct help, like with a concern, like you've got pelvic floor dysfunction, you've got prolapse, you've got diastasis recti, you've got a leaking bladder, or even if you don't have those concerns and you're just looking for optimal bounce back post baby, Mutu is perfect. I'm not pregnant right now. I didn't just have a baby. I still continue to do Mutu because it has become such a cornerstone for not just core and pelvic floor, but like I feel from the waist down confidence and comfortability with my body. And then emotional support. And it's funny because we talk about, skin to skin contact and eye contact and co-regulating with your baby. And that's usually included under emotional support. But like those skin to skin contact has a huge hormonal cascade, a huge physiological response with it. So just keep that in mind. And then support and mindset, a circle of care of people that really, who can pour into you, giving yourself permission to ask for help and letting go of the myth that you are failing if you need support. Healing is not supposed to be like white knuckling your way through motherhood. It comes from being seen and supported and resourced. Is it too late to address birth trauma? Absolutely not. We have seen radical transformation, radical breakthroughs in toddlers and kids and mamas who were never supported early on. Healing has no deadline. We sometimes think like, oh, I missed the boat. Not true. Whether your baby is 2 days old, he's 2 months old, he's 2 years old, that nervous system can still rewire and still heal. The sooner you do it, the less time, the less input it's going to take. But you can still rewire and heal years out, okay? Next one on here is, what does a baby adjustment look like? So I mentioned already that it truly is just, it is the lightest pressure. It might honestly look like a hold, or some people like say the baby massage. I like to think of it as like a little vibration. It's very soft, it's very safe. Many babies sleep through it. And for the fresh mama, or even more seasoned mama, adjustments will still remain gentle and safe, with maybe a little bit more flair as we are like helping moms shift into ease, into calm, into comfort. How soon can I come in? You can bring in baby and yourself literally the day you leave the hospital. Earlier the better, like I said, but again, it's never too late. If you are like curious how that works, like with breast tenderness, cool, we've got pillows for that. If you are hesitant about laying on your tummy, as you probably should be, those areas are tender. They just ran through a marathon in a matter of, hopefully for you, a few hours, potentially longer than that. So we can do everything that we need to do in a seated position. If you're like, oh, I feel great, I can lay on my tummy, cool, but maybe we're not ready for drop pieces. There's so many tailors and adjustments to the adjustment that we make, guys. It is never too late. You do not need to settle for an incomplete recovery. You don't have to keep guessing why your baby's fussy. You can reclaim your birth story, your body, and your baby's thriving nervous system. Chiropractic isn't just for pain. It is truly about possibility. We want to support that journey. So you can actually book a visit with our office by following this QR code on the right. You can connect with us on our social pages. That's where you found this. There's also more education. There's more inspiration. There's maybe some comedy if you tune in with us. I ask you, share this video with a friend. If you know a mama who is postpartum at all, share this with them. We want to raise, and we expect to raise, the standard of care one empowered family at a time. Upcoming with Healing Touch Chiropractic, Dr. Tiff is hosting our next Impact Collective at her condo, May 22nd from 5 to 7. It's free. It's open to all women who are truly committed to being the next best version of yourself. So regardless if you're a stay-at-home mom, if you're an entrepreneur, if you are in a W-2 9-to-5, if you love your profession, or if you are like drowning in overwhelm and burnout, all of you gals are welcome. But there is limited seating. So if this entices you, which it dang well should, the link is here. Sign up right away. The next thing on this slide is May 24th. It's a Saturday at 10 a.m. We are co-hosting a resistance band class. It's open to everyone, again, for $15, $25 if you need Coach Meg, who will be coaching the class, leading the class, to supply you with bands. The next thing on this list, Dr. Tiff will also be talking about caring for the athlete in her upcoming Facebook Live workshop, May 29th, 11 a.m., right here. And then on the 5th of June, which I'm just realizing is my grandma's birthday. That's fun. 5th of June, I'll be going into all things holistic, caring for your infant, your young baby, your kiddo. We're excited to continue to connect with you all, to continue to learn with you all. Until then, here's to your healthy, happy home. Thanks, guys.